I am Michael Mize, student physical therapist at Campbell University. Today, I will be teaching and demonstrating the strain counterstrain technique for the lateral epicondyle tender point of the elbow through the first rib combo treatment. Strain counterstrain was developed by Dr. Lawrence Jones in the 1950s with a theory that proprioceptors and somatic dysfunction proposed a neural basis for joint dysfunction with abnormal activation of muscle spindles. Strain counterstrain is a passive positional procedure that places the body in a position of greatest comfort, thereby relieving pain by reduction and arrest of inappropriate proprioceptor activity that maintains somatic dysfunction. The way strain counterstrain is thought to work is that by placing the aggravated muscle into a position of greatest comfort, this triggers a neural signal that is delivered to the muscle spindle that acts in a way of calming and resetting the spindle itself. There is limited literature that exists to support the efficacy of strain counterstrain. However, Hutchinson 2007 reports that strain counterstrain techniques may be an effective technique in the treatment of primary tender points around the elbow in subjects with a history of recreational sports injuries of the upper extremity. Strain counterstrain techniques can produce decreases in pain intensity as reported from mechanical pressure at the primary tender point. The purpose of this technique is to assess and treat the tender point of the lateral epicondyle at the elbow. A tender point is a sensory manifestation of a neuromuscular or musculoskeletal dysfunction. They present as small zones of tense, tender, edematous muscle and fascial tissue about 1 centimeter in diameter. The tender point for the lateral side of the elbow is located 5 centimeters above the lateral epicondyle on the lateral shaft of the humerus. To locate the tender point, have the patient lying supine with the arm resting on the plinth. Palpate the lateral shaft of the humerus, approximately 5 centimeters above the lateral epicondyle. Once a true tender point has been located, proceed to treatment. The following is the technique for the strain counterstrain first rib combo treatment. The key is to remember that all movements should be passively performed by the therapist. Position the patient with cervical rotation towards the tender point. Take the arm, passively, slowly, and gently move the arm and place the dorsal aspect of the hand on the patient's forehead. Once this position is achieved, rotate the patient's head away using the hand and the patient's neck to rotate away. Relocate the tender point on the lateral side of the elbow and hold with light pressure for 90 seconds. The key here is to explain to the patient and have your patient be as relaxed as possible. Once you have repositioned the patient and you have them in the position of greatest comfort, monitor the tender point for 90 seconds or more. Once 90 seconds has passed, rotate the patient's head back to neutral. Passively move the arm in a slow and controlled movement back to the plinth. Again, the key is passive movements by the therapist with slow and controlled movements. Once you've repositioned your patient's hand on the plinth, reassess the tender point. This is done by palpating the lateral side of the humerus 5 centimeters above the lateral epicondyle. What you're looking for is a reduction in 70% or more in pain. If the patient does not report that there is reduction of greater than 70%, reperform the treatment with fine-tuning. Now I'm going to demonstrate this technique on a patient. Lee, how you doing today?
I'm alright.
How's that elbow feeling?
Yeah, it hurts a little bit.
Turn a little bit? Okay. Well, what I'm going to do is I'm going to palpate your elbow right here on the outside of it. I'm looking for areas that are very tender. When I'm palpating it, there's a certain place I'm going to palpate, and I want you to let me know if it increases the pain or if it's very tender. If we find a spot like that, I'm going to treat it with a technique called Counterstrain. What this technique is, I'll have you lay on your back, and I will passively put you into a position that will just relax your body. By relaxing your body, it basically sends a signal to your muscle that causes it just to relax. It's just a signal. It's kind of like a fire alarm. So something happens within your elbow, your muscles start to freak out, and we have these things called muscle spindles. What they do is they lock up, and it causes the muscle just to freak out. By this technique, what we can do is cause that muscle to relax and send a signal to it that it's okay. If that's all right with you, we'll proceed with the treatment.
Yep.
Okay. What I want you to do is I want you to go ahead and lay on your back with your elbow on this side.
Okay.
And I just want you to relax. Take a few deep breaths for me. Good. And just relax. Let me know if this area right there, is that tender? Is that more tender than up here? Is it more tender than down here?
Yeah.
So right there is pretty tender.
Yeah.
Okay. So what I want you to do is I want you to let me perform all these movements. I just want you to relax. And at any time you're uncomfortable or anything causes excessive pain, just let me know. But just try to relax the best that you can. Okay. Let me move your arm back into position. And now I'm just going to feel see how the spot is again. Let me know if the pain is better. Any pain?
A little, not really though.
Not really? Would you say that your pain is 50% better, 70% better, 80% better?
Probably about 80.
You'd say about 80% better? Good. It's been a successful technique for us. That concludes my demonstration of the Counterstrain technique for the lateral epicondyle with the first rib combo treatment.